If we can prove that God exists, then an obvious follow-up question is, what does he expect from me? What does he want from me? How does he communicate with me today? I want to talk for just a minute about this book right here, the Bible, God's Word. Oftentimes we use the expression that God's Word is inspired or God-breathed, but sometimes we don't really give a good definition of what that truly means or how we can go about proving that. Basically, when somebody says the Bible is inspired, it means that, yes, they use their own handwriting, their own personality, but the words were breathed out by God. They were penned by God. So he is actually communicating with us today through this book. And you say, how do you know for sure, Brad, that it is inspired? Maybe it's just another book like other books out there. Books in a bookstore that are on the bestseller list. Well, let me make sure you understand, this is more than just a good book. Lots of different ways that I could prove that to you. For instance, we could spend time looking at the factual accuracy of God's Word. You take the book of Acts, for instance. Look at things like all of the islands mentioned, the places mentioned, the people, everywhere checkable. The author got it right. We could talk a little bit about prophecy in the Bible. Not like modern day prophets that promise all kinds of things and charge you $9 a minute. No, these were very specific prophecies that give places of birth, lineages of people. Talk about how someone is going to die. We could talk about the unity of the Bible. When you go to a bookstore today and you select one off the shelf, normally it's got one or two authors. It's written over a span of maybe a few years. And yet, this is a book that was written over a span of about 1,600 years, more than 40 different authors. And yet, their combined message all fits together like hand in glove. So, we've got unity. We could also talk about the miracles of the Bible. The one that I would probably go to first would be the resurrection. Lots and lots of good factual information about the resurrection. In fact, if Jesus Christ didn't make it out of that tomb, then you and I don't have any hope. What do those miracles mean, and what do they point toward? What I want to do, though, for just a moment of your time, is I want to look at the scientific accuracy of the Bible. Because you see, there were things that were written thousands of years ago that we have only just recently come to understand. Things that could have only been penned in this book, be it through the inspiration of God. Let me give you just two quick examples. If you have a Bible, flip open to Genesis chapter 17, verse 12. Again, that's Genesis chapter 17, verse 12, where we find God commanding Abraham to circumcise newborn males on the 8th day. Now, why day 8? Why not day 12 or day 15? Well, friends, we know the answer today. Medical science has shown that blood clotting is dependent on three factors. You got to have all three of them. You got to have platelets, you got to have vitamin K, and you got to have prothrombin. Now, we have further learned through centuries of trial and error experiment that vitamin K is actually responsible for the production of one of the other clotting factors, prothrombin. Now, here's what that means. That means if an infant doesn't have enough vitamin K in their system, and you make an incision, then they're likely to hemorrhage out and die. We have also learned through centuries of trial and error experiments that vitamin K is actually produced in the infant's intestinal tract on days 5 through 7. So think with me for just a moment. Why does the Bible specify day 8? Friends, day 8 is the perfect day to do it. It's the day in which you have the most clotting factors available. Now think about that for just a moment. God specified to Abraham, circumcise newborn males on the 8th day. Hundreds of years later, we learn through medical science that that's the day in which we have the most clotting factors available. Now, I realize some of you may be saying, wait a second, you know, my son, he was circumcised just 2 days after he was born. We went home from the hospital, and that's right. And before that child received that particular procedure, it was given an injection of vitamin K. It's usually one of the very first shots that a child receives, a healthy baby in our country, allowing them to clot blood a whole lot quicker. Flip over to Numbers chapter 19. Now let's talk for just a moment about bacteria. In Numbers chapter 19, they're given laws about cleaning up after the dead. If you look carefully, Numbers chapter 19, starting at verse 14, it says, this is the law when a man dies in a tent. All who come into the tent, all who are in the tent, they shall be unclean for 7 days. He then goes on to give a prescription of how to clean it up. Look at what he says in verse 18. He says, a clean person shall take a hyssop, dip it in the water, sprinkle it on the tent, on the vessel, on the one who has touched the bone, the slain, the dead, of the grave. Now, that watery solution, if you back up and look in verse 17, it had already been passed through ashes of a burnt heifer. Why is that important? He's actually giving them a recipe for an antibacterial soap. If I were to ask you, what does it take to make lye soap? Well, we know you extract the lye out of ashes, just like verse 17 prescribes, that watery solution, but he's not finished there. The delivery mechanism he gives, that hyssop plant, we know today that has antifungal and antiseptic properties. You see, he was giving them a cleaning solution. And you look at me and you say, yeah, so what? What's the big deal? The big deal is we did not realize until about the 17th century that bacteria could be transmitted from dead people to living people. Over in Europe, one of the common practices was for doctors, medical students, they would perform autopsies in the morgue of the hospital in the morning. All the patients that had died the day before, they would open them up. They would have their hands in those infected bodies. And then they would march upstairs and begin treating other patients, usually without ever washing their hands. And whatever bacteria were in the dead were oftentimes transferred to those who were living. And yet God's word was already giving a prescription long before we even knew what a bacteria was. Very first time that they saw bacteria, 1677. Anton von Leeuwenhoek, he made his own microscope. He looked down through it. He saw these little things swimming around. It would be almost 200 years later when a guy by the name of Louis Pasteur came along and said, you know those little bacteria, those little bugs, they can cause disease and even death. It's actually Louis Pasteur's germ theory for disease that we still follow today in medicine. And yet, friend, what I want you to think about is this. Long before Louis Pasteur ever existed, long before Anton von Leeuwenhoek made a microscope, God's word was already giving us medical advice that we wouldn't understand for hundreds of years later. You want proof the Bible's inspired? It's there. You can walk through the fields of biology, astronomy, oceanography, physics, medicine, and you can pull out verse after verse after verse that shows, yeah, this book, it is different from every other book on the planet. It is God's way of communicating with you. Question is, are you going to listen and heed it. I hope you'll think on these things. Thanks.